Welcome back, everyone, to another deep dive. This time, we're going to take a closer look at substance use disorder.
Definitely an important topic, especially for our audience. Nurses and nursing students encounter this all the time.
I think we're all aware of the big picture, that this is a major issue in healthcare. But to really understand it, I think we need to start by defining exactly what we mean by substance use disorder.
Right. Because there are a lot of misconceptions, and it's really a very complicated condition. I think the key is to approach it from a biological, psychological, and social perspective all at the same time.
And we're fortunate to have some really excellent sources for this deep dive. A chapter from a nursing pharmacology textbook, a news article about the growing problem of polysubstance abuse, and an opinion piece from a physician advocating for more access to methadone treatment.
Absolutely. And those sources really highlight the complexities and the challenges that come with substance use disorder, but also the hope for effective treatment and recovery.
So let's dive into that textbook chapter first. It really lays the groundwork for understanding substance use disorder and its impact. It actually starts by highlighting the sheer prevalence of this issue.
Right. And they mentioned that a national survey found over 164 million people aged 12 or older in the United States reported using substances in just the past month.
That's a staggering statistic when you think about it. It just reinforces the reality that substance use disorder touches every corner of society.
And I think a point that they emphasize in the textbook is that it's a chronic relapsing condition, and it's that cyclical nature that can be so difficult for individuals and their families.
Absolutely, and there's a lot of stigma associated with relapse. But the chapter is very clear that relapse is not a failure, but rather a signal for the need to adjust and maybe intensify the treatment approach. It's an opportunity to reevaluate and provide stronger support, and I think that's a message that really needs to be heard.
Definitely. It's a reminder that recovery is a process, and it's okay to need additional support along the way.
Okay, so the chapter defines addiction as psychological or physical dependence on a drug or a psychoactive substance.
Which really gets at the core of what we're talking about. Because addiction isn't just a simple choice. It's a complex interplay of factors that lead to these very strong compulsions to use substances despite negative consequences.
So I think for our listeners, nurses and nursing students, it's really important to consider the implications of these definitions, because we are on the front lines of caring for patients struggling with substance use disorder.
Exactly. We have to be able to recognize the signs, the symptoms, and know how to implement evidence-based interventions. And that's what we'll be discussing as we go deeper into this deep dive.
The textbook chapter also does a really good job of outlining the different categories of commonly abused substances, grouping them as opioids, stimulants, and depressants.
And it's essential to understand the unique characteristics of each category because that informs our approach to assessment and treatment.
Let's move on from the textbook and talk a bit about this news article about polysubstance abuse.
The article really brings attention to a concerning pattern, the Holy Trinity as they call it, which involves combining an opioid, a benzodiazepine, and a stimulant.
And it's a really dangerous combination. This article was saying that it's linked to a significant increase in overdose deaths.
Absolutely. You're basically compounding the risks of each substance when you combine them like that, and it's often a recipe for disaster.
They did mention one interesting development, these abuse-deterrent opioid formulations that are designed to make it harder to misuse them.
That's right. For example, some have polymers in them that make the pills incredibly difficult to crush, and some are formulated so that if you try to alter them, they release antagonists that block the euphoric effects.
Now that sounds really promising, but the article does caution that these formulations are not foolproof and that more comprehensive strategies are still needed.
Of course, because ultimately we have to address the root causes of addiction and provide individuals with the support they need to overcome these challenges.
Let's bring in the perspective from that opinion piece written by a physician who is a big advocate for increasing access to methadone maintenance programs. They really make a compelling case that methadone is a very effective treatment for opioid use disorder.
And they point out that methadone is a long-acting opioid agonist that helps manage cravings and withdrawal symptoms without the intense highs and lows associated with heroin or other illicit opioids.
It's interesting. They also tackle the stigma surrounding methadone treatment head-on.
Exactly. And they argue that when prescribed and monitored appropriately, methadone can be a truly life-saving medication.
Okay, so let's dive into the specific categories of commonly abused substances, starting with opioids. We have a research paper here that goes into detail about how opioids actually work in the body.
It explains that opioids bind to receptors in the brain, spinal cord, and other parts of the body, producing analgesia and, unfortunately, that feeling of euphoria that contributes to their addictive potential.
The paper talks about the role of dopamine as a neurotransmitter and how opioids flood the brain with dopamine, essentially reinforcing the pleasurable effects and driving that cycle of addiction.
It's really remarkable how these substances can hijack the brain's reward system, making it incredibly challenging to break free from their grip.
Absolutely. And that's really one of the reasons why addressing opioid withdrawal has to be done very carefully.
The withdrawal syndrome associated with opioids can be incredibly severe, with intense cravings, muscle aches, nausea, vomiting, really a whole host of distressing effects.
The paper highlights that medication-assisted treatment is essential for managing those symptoms safely and effectively.
Precisely. Medications like methadone, buprenorphine, and naltrexone can really help to mitigate those symptoms, reduce cravings, and provide a foundation for long-term recovery.
I found it really interesting that they included a section on newer medications for opioid use disorder, specifically mentioning lofexidine.
Yeah, lofexidine, also known as Lucemyra, is an alpha-2 adrenergic agonist that was recently FDA approved.
And it works by reducing the release of norepinephrine, which helps to manage some of those really uncomfortable autonomic symptoms of withdrawal, like sweating and anxiety.
It's a valuable addition to our toolkit for treating opioid use disorder, and it really shows that research and development are continuing in this field.
And it's not just prescription opioids that we need to be mindful of. Over-the-counter medications can also be misused, and we have a report here from the National Institute on Drug Abuse that talks about that.
And it really underscores that education is essential. Even readily available medications like dextromethorphan and diphenhydramine can pose serious risks when taken in excessive amounts.
Dextromethorphan's in cough syrup, right?
Right. It's a cough suppressant, but in high doses, it can cause dissociative effects and hallucinations.
And diphenhydramine is an allergy and sleep medication.
Exactly. It's an antihistamine, but when abused, it can lead to drowsiness, confusion, and even seizures. It's really crucial for nurses to educate patients and their families about these risks and to emphasize the importance of responsible medication practices.
Okay, let's shift gears now to stimulants, a completely different category of substances that can have very powerful effects on the brain and body. We have some resources here from the National Institute on Drug Abuse, and this research article that breaks down the mechanisms of how stimulants work.
It explains how stimulants essentially increase the levels of certain neurotransmitters in the brain, like dopamine, norepinephrine, and serotonin, which all play significant roles in mood, attention, and motivation.
And that explains the characteristic effects we see with stimulant intoxication, right? The increased energy, the focus, and of course that sense of euphoria.
Right. But along with those effects, there are also potential risks, particularly with chronic use.
Like cardiovascular problems, anxiety, paranoia, even psychosis.
So it's crucial to be aware of both the positive and the negative consequences of stimulant use.
Let's talk about some specific stimulants that are commonly misused, starting with methamphetamine, a potent and highly addictive drug.
It enters the brain very quickly, releasing large amounts of dopamine, norepinephrine, and serotonin.
And that triggers those really intense feelings of euphoria, the energy, the alertness that people associate with meth. We have a research article here that details the long-term consequences of methamphetamine use, and it paints a really grim picture.
It's devastating. Chronic use can lead to significant neurological damage, especially to dopamine neurons in the brain, and that can result in cognitive impairment, memory problems, and even movement disorders.
And then there's MDMA, also known as ecstasy or Molly. It's become incredibly popular, especially among young adults.
It's a synthetic drug that acts as both a stimulant and a psychedelic, so people report these feelings of euphoria, empathy, heightened sensory perception, and that's what makes it so popular in club and rave settings.
But like you were saying, it's not a harmless party drug.
Right. MDMA use can lead to hyperthermia, dehydration, hyponatremia, and even serotonin syndrome. And those are all serious medical conditions.
Absolutely. And there is increasing concern about the long-term neurotoxic effects of MDMA.
Chronic use can damage those serotonin neurons in the brain, and that can result in cognitive problems, mood disorders, really long-lasting effects.
And lastly, in our discussion of stimulants, we have to talk about cocaine.
A potent stimulant that blocks the reuptake of dopamine, norepinephrine, and serotonin in the brain.
And that leads to those intense feelings of euphoria, energy, confidence that many people seek from cocaine. But we have to acknowledge the dark side of cocaine use, the potential for addiction.
That's right. Chronic use can lead to significant changes in the brain's reward pathways, and that makes it incredibly difficult to stop using cocaine.
And we shouldn't forget about the different forms of cocaine.
Powdered cocaine, which is typically snorted or injected, and crack cocaine, which is a smokable form that's much more potent and therefore even more addictive because of those rapid effects.
So let's shift our focus now to another major category, depressants, which often don't get as much attention as opioids or stimulants, but they certainly have their own set of risks and challenges. I think our psychopharmacology textbook does a really good job of explaining how depressants work.
Right. They emphasize the role of GABA, an inhibitory neurotransmitter in the brain. Depressants enhance the activity of GABA, which essentially reduces neuronal excitability, and that's what leads to those feelings of relaxation, sedation, reduced anxiety.
The textbook talks about the potential risks of depressant use, especially with long-term use.
It can lead to tolerance and dependence, and that means that individuals may need higher doses to achieve the same effects, and they may experience really uncomfortable withdrawal symptoms when they try to stop.
And of course, mixing depressants with alcohol is incredibly risky.
Absolutely, because you're basically amplifying those sedative effects, and that can easily lead to overdose.
Let's take a look at some specific depressants that are commonly misused, starting with benzodiazepines, a class of medications that are often prescribed for anxiety and insomnia.
They bind to specific sites on those GABA receptors in the brain, which enhances that inhibitory effect of GABA, and that's what produces those effects that people seek: reduced anxiety, muscle relaxation, and sedation.
The research article we have here mentions that there are different types of benzodiazepines, and each one has its own unique pharmacokinetic profile.
Exactly. But it's crucial to remember that all benzodiazepines carry a risk of dependence, especially with long-term use or at high doses.
And the potential for interactions with alcohol is a serious concern, as that combination can lead to respiratory depression.
Right, which can be life-threatening.
Now, we have to talk about barbiturates, a class of depressants that have a really interesting history.
They were widely used in the past as sedatives and hypnotics.
But their addictive potential and risk of overdoses really led to a decline in their use.
But they are still used in some medical settings, for example, in anesthesia and for controlling seizures.
So it's a reminder that even substances with a history of abuse can have legitimate medical uses.
It's really about careful prescribing practices and understanding the risks and benefits.
Okay, let's move on to a depressant that's been the subject of a lot of discussion and debate lately: marijuana.
Marijuana, or cannabis, contains over 100 cannabinoids, and the most well-known one is delta-9 tetrahydrocannabinol, or THC.
And THC is the one primarily responsible for marijuana's psychoactive effects.
Exactly. And we have a research paper here that goes into detail about its pharmacology and therapeutic potential.
It explains that THC binds to cannabinoid receptors throughout the brain and body, and that's what produces that range of effects: the euphoria, the relaxation, the altered perception, the increased appetite.
But it's important to note that the long-term effects of marijuana use are not fully understood yet. More research is definitely needed.
It's an evolving area of research, and of course there's the ongoing debate about marijuana's legalization.
Which brings up all these ethical, legal, and public health considerations.
It's a complex issue, for sure. Now, we have to address the darker side of depressant use and talk about drugs that have been used in drug-facilitated sexual assault.
I think the public health fact sheet we have here does a good job of describing flunitrazepam and gamma-hydroxybutyrate, commonly known as roofies and GHB.
And those drugs have that ability to sedate and cause amnesia, which makes victims incredibly vulnerable to assault.
Exactly. And it's often difficult for victims to recall the events, which makes prosecution even more challenging.
The fact sheet really emphasizes the need for prevention strategies: never leaving drinks unattended, being aware of our surroundings, and watching out for each other in social settings.
It's a reminder that we all have a role to play in preventing drug-facilitated sexual assault.
Now, let's talk about a substance that's both widely used and often abused: alcohol. We all know it's legal and readily available, but the potential for misuse is very real, and that leads to a whole host of health and social problems.
And the substance abuse textbook we have here does a great job of breaking down the pharmacology of alcohol. It explains that alcohol, also known as ethanol, is a central nervous system depressant that affects virtually every organ in the body.
So, it's absorbed into the bloodstream and travels to the brain, and it disrupts that delicate balance of neurotransmitters.
Exactly. And that's what leads to those characteristic effects of alcohol intoxication: the relaxation, the lowered inhibitions, the impaired judgment, the slurred speech.
The textbook also talks about how alcohol is metabolized in the liver, and excessive consumption can really overwhelm the liver's capacity to process it.
Right, and that's when you start to see those unpleasant hangover symptoms. But more importantly, chronic alcohol abuse can lead to very serious and long-term consequences.
Like liver disease, heart disease, pancreatic disease, cancer, and a whole host of neurological disorders.
It's not just the physical consequences either. Alcohol abuse can also contribute to a wide range of psychological and social problems like depression, anxiety, relationship issues, financial problems, and legal issues.
We have a research article here that specifically looks at the neurobiology of alcohol addiction, which I found really fascinating.
It explains how alcohol initially enhances dopamine activity in the brain's reward system, and dopamine is associated with pleasure, motivation, and reinforcement. And that helps to explain why people find alcohol pleasurable, especially in those early stages of
It's
use.
like a quick fix for feeling good.
Right. But over time, the brain adapts, and that leads to tolerance and dependence, meaning that individuals need to consume more and more alcohol to achieve those same effects.
And then when alcohol is abruptly stopped, they experience withdrawal symptoms, which can be very difficult to manage.
Exactly. And we have a clinical guideline here on the management of alcohol withdrawal that really underscores the importance of recognizing and addressing those withdrawal symptoms early on because they can escalate very quickly.
And the guideline stresses the need for a comprehensive approach, including medications like benzodiazepines to reduce anxiety and prevent seizures, supportive care like hydration and nutritional support.
And of course, close monitoring for any potential complications.
Let's move on to another highly addictive substance, nicotine. We have a report here from the Surgeon General on the health consequences of smoking that really lays out the devastating impact of tobacco use. It details all those harmful chemicals found in cigarette smoke, nicotine, tar, carbon monoxide, really a whole host of carcinogens.
And those chemicals can really wreak havoc on the body's organs and systems. That's why smoking is linked to so many serious diseases like lung cancer, heart disease, stroke, and COPD.
The report also emphasizes how difficult it is to overcome nicotine addiction.
It explains how nicotine activates the brain's reward pathways, leading to cravings and withdrawal symptoms that can be incredibly intense.
And that's why so many smokers struggle to quit, and many relapse multiple times.
Quitting smoking can be incredibly challenging, but it's also one of the most important things someone can do for their health.
We have a research article here that looks specifically at the neurobiology of nicotine dependence and how it hijacks the brain's reward system.
It explains how nicotine binds to nicotinic acetylcholine receptors in the brain, triggering the release of dopamine. And that dopamine surge reinforces those pleasurable effects of smoking, making it more likely that those behaviors will be repeated.
It's almost like nicotine sets up a positive feedback loop in the brain.
And over time, chronic exposure desensitizes those receptors, leading to tolerance and dependence, so people need to smoke more and more to achieve those same effects.
The article also talks about the physiological effects of nicotine on the body, like the increased heart rate and blood pressure.
And those are some of the contributing factors to the cardiovascular risks associated with smoking.
We also have a clinical guideline here on the management of tobacco withdrawal, which I think is a really useful resource for nurses. It describes the typical withdrawal symptoms that people experience when they try to quit smoking. The cravings, the irritability, the anxiety, the difficulty concentrating.
It's important to understand that these symptoms can be quite intense, so having support can make a huge difference. And fortunately, there are effective strategies for managing those symptoms.
Like behavioral therapy, support groups, and of course those pharmacological interventions.
Right, and the guideline highlights the importance of patient education, really helping people understand the withdrawal process, developing coping strategies, and having support from both healthcare professionals and loved ones.
Absolutely. It's about empowering people to make those changes. Let's talk a bit more about those pharmacological interventions for nicotine dependence.
We have a review article here that does a nice job of outlining the different types of medications available to help people quit smoking. There are two main categories: nicotine replacement therapies and non-nicotine medications.
Nicotine replacement therapies, like the gum, patches, lozenges, inhalers, and nasal sprays, provide a controlled dose of nicotine without all those other harmful chemicals in cigarette smoke.
Right. And that helps to alleviate those withdrawal symptoms and cravings, making it a little bit easier to break the habit of smoking. And then there are the non-nicotine medications like bupropion and varenicline, which work on different pathways in the brain.
Bupropion is an antidepressant that's also effective for smoking cessation, and varenicline is a medication that was specifically developed for helping people quit smoking.
And it works by partially activating nicotinic receptors in the brain, which reduces the pleasurable effects of smoking and the intensity of those cravings.
It sounds like there's a whole array of options available to help people quit smoking, and as the article emphasizes, it's really about finding the best option for each individual.
That's the key, taking into account their specific needs and preferences.
We've covered a lot of ground in this first part of our deep dive into substance use disorder, really laying the foundation for understanding the different categories of substances and how they affect the brain and body.
I think it's a great starting point for our listeners. And in the next part, we'll delve even deeper into the nursing assessment and care of patients with substance use disorders.
Now let's shift gears and focus on the nursing assessment and care of patients struggling with substance use disorder. It's one thing to understand the pharmacology, but it's a whole other level to apply that knowledge in a real clinical setting.
Absolutely. And the nursing textbook chapter we have for this deep dive does a fantastic job of providing a comprehensive framework for assessing and caring for these patients. It really emphasizes a holistic and patient-centered approach, recognizing the complex interaction of physical, psychological, and social factors in addiction.
Right, because it's not just about treating the physical symptoms of withdrawal, it's about addressing the whole person.
Exactly. And the chapter outlines some really key components of the nursing assessment, stressing the need for a thorough and sensitive approach. It encourages nurses to gather detailed information about the substance or substances being used, the duration and pattern of abuse, the potential for withdrawal, any co-occurring medical or psychiatric conditions, really getting a complete picture of the patient's situation.
And creating a safe and non-judgmental environment is paramount.
Absolutely. The chapter suggests using open-ended questions to encourage patients to share their experiences openly and honestly, really actively listening to their narratives and validating their feelings to build that trust and rapport. It's about making the patient feel heard and understood.
And it's not just about the patient's self-report. Getting a comprehensive medication history is also crucial.
Right. We need to know about all medications they're taking, including prescription drugs, over-the-counter medications, herbal remedies, vitamins, dietary supplements, everything, because there's always that potential for drug interactions, which can really complicate things, either intensifying the effects of the substance use or making withdrawal management more difficult.
That's like a puzzle. You have to put all the pieces together.
Precisely. And that includes assessing for any behavioral or mood changes, as well as gathering information from family members or significant others with the patient's consent, of course.
That collateral information can be incredibly valuable.
It can provide insights into the patient's substance use patterns and the impact it's having on their relationships, their work, their daily functioning. It helps to get a more complete picture.
And of course, reviewing lab results like liver and kidney function tests, drug screening results, HIV and hepatitis screening tests.
It's essential to get that baseline data and identify any potential complications related to substance use.
Right, because substance use can affect multiple organ systems, so we need to be aware of those potential risks.
And obtaining baseline vital signs is crucial too, documenting any physical signs of substance use or withdrawal. That provides a starting point for monitoring changes over time.
We've talked about the CAGE questionnaire before, which is a really useful screening tool for alcohol use disorder.
And the chapter also mentions other screening tools like the SASI, the MATG for older adults, and the PUZIT for teenagers.
So having those tools in our toolbox can really help us to identify substance use disorders in different populations.
Definitely. The chapter also emphasizes the importance of maintaining confidentiality, privacy, and a non-judgmental attitude throughout the assessment process.
It's about upholding those ethical obligations to treat all patients with respect and dignity, regardless of their substance use history.
Right. Because stigma is a huge barrier to treatment, and we, as nurses, have a responsibility to create a safe and supportive environment for our patients.
The chapter also gets into specific assessment considerations for different categories of substances, recognizing that each substance has its own unique effects and withdrawal profile.
Right. For example, when assessing patients who use opioids, it's crucial to evaluate the route of drug administration, as intravenous use carries a higher risk of infection and overdose.
And respiratory status is a major concern with opioids because respiratory depression is a life-threatening complication of overdose.
So, monitoring respiratory rate and rhythm is essential, along with assessing for any signs of respiratory distress,
And we have to be vigilant for those signs and symptoms of opioid withdrawal.
like dilated pupils, sweating, muscle aches, gastrointestinal distress, things like that.
Now, for patients who use central nervous system stimulants like cocaine or methamphetamines, monitoring vital signs closely is really important.
Right, because stimulants can increase heart rate, blood pressure, and body temperature. And we also need to be assessing for those neurological and psychological effects that can occur with stimulant use.
Like agitation, anxiety, paranoia, psychosis, all those things that can manifest with stimulant intoxication.
Now, when we're assessing patients who use central nervous system depressants such as benzodiazepines, barbiturates, or alcohol, respiratory status is again a major concern.
Because these substances can suppress breathing.
Exactly. And that can lead to respiratory failure if not addressed promptly. So, monitoring respiratory rate, depth, and effort is essential, along with being prepared to intervene if necessary.
And we need to be assessing for neurological effects too.
Things like slurred speech, impaired coordination, decreased level of consciousness, these are all signs that the central nervous system is being depressed, and we need to intervene to prevent further complications.
Marijuana is another substance that we need to be able to assess for.
Right. We need to assess for cognitive and motor impairment, altered perception, and any unusual behavioral changes.
And it's important to remember that long-term marijuana use can lead to problems with motivation and even depression.
And when we're assessing patients who use alcohol, it's crucial to gather information about potential drug interactions.
Especially with older adults who may be taking multiple medications.
Exactly. And monitoring blood alcohol levels can provide valuable information about the severity of intoxication. And of course, we have to be vigilant for those signs and symptoms of alcohol withdrawal, especially the more severe manifestations like seizures and delirium tremens, which can be life-threatening.
And lastly, for patients who use nicotine, we need to be mindful of the effects it can have on cardiovascular function.
Right. Monitoring heart rate, blood pressure, and any changes in weight is important, as nicotine can affect both cardiovascular function and appetite.
And assessing for any respiratory or gastrointestinal symptoms is important too, because nicotine can exacerbate conditions like asthma or ulcers.
So, the key takeaway here is that assessment for substance use disorder is multifaceted. We need to consider the specific substance being used, the potential for withdrawal, any co-occurring medical or psychiatric conditions, and the patient's overall physical and psychological well-being. It's a comprehensive process that requires careful observation, skillful interviewing, and the use of appropriate screening tools.
Now that we've discussed the assessment process in detail, let's turn our attention to nursing interventions and the principles of patient-centered care for individuals with substance use disorders. This is where our role as nurses really comes into play, and we have a lot to offer these patients.
Absolutely. The chapter really emphasizes our crucial role in helping patients navigate the challenges of substance use disorder, and that encompasses everything from managing acute intoxication and withdrawal to providing education, support, and advocating for long-term recovery.
And I think one of the most important things we can do is to approach these patients with a non-judgmental and empathetic attitude.
I completely agree. We have to remember that addiction is a complex medical condition, not a moral failing, and our patients deserve our compassion and understanding.
The chapter outlines several key nursing interventions that we can implement. First and foremost is ensuring patient safety, especially during those acute phases of intoxication or withdrawal, because things can escalate quickly.
Exactly. We need to be implementing appropriate safety precautions, like seizure precautions for patients at risk of withdrawal seizures, and that may involve having suction equipment readily available, padding the bed rails, having a saline lock in place for emergency medications.
And close monitoring of vital signs, neurological status, and mental state is critical.
Yeah.
We need to be watching for any changes that could indicate a potential complication.
And providing a calm and supportive environment for those patients experiencing withdrawal or detoxification is really important. That may mean minimizing environmental stimuli, offering emotional support, educating patients and families about the withdrawal process and what they can expect. It's about creating a therapeutic space that promotes healing and reduces anxiety.
It's about meeting patients where they are and helping them feel safe and supported through this really challenging process.
Exactly. And that includes addressing their physical and emotional needs during withdrawal.
So, managing pain, nausea, vomiting, and any other physical symptoms, and providing emotional support and counseling to help patients cope with anxiety, depression, or any other psychological challenges.
And patient education is absolutely crucial, empowering patients to become active participants in their own recovery.
Right. We can educate patients and families about substance use disorders, treatment options, support groups, community resources, really giving them the tools and knowledge they need to make informed decisions and navigate this complex landscape.
And providing clear instructions and information about any prescribed medications is essential, helping patients understand how their medications work, the potential side effects, and the importance of taking them as prescribed. It's about promoting medication adherence and minimizing the risk of complications.
And we have to ensure that our patients understand their rights to ethical and compassionate treatment.
Right. We, as nurses, have a responsibility to advocate for our patients' well-being and ensure that they are treated with respect and dignity.
Now, we need to talk about the specific needs of older adult patients with substance use disorders because it's a growing concern. And it's often overlooked because the signs and symptoms can be masked by other medical or cognitive issues that are common in older adults.
That's a really important point. We need to have a high index of suspicion when we're assessing older adults because those signs might be subtle or attributed to other things. And there's a real potential for drug interactions between alcohol or other substances and the medications that older adults are often prescribed.
Which can increase the risk of adverse effects, falls, injuries, all sorts of complications.
And it's not just about the physical risks. Substance use can really impact an older adult's mental and emotional well-being.
Absolutely. It can contribute to depression, anxiety, social isolation, and really exacerbate any pre-existing mental health conditions.
And we shouldn't forget the importance of involving family members and significant others in the treatment and recovery process. They need our support and education, too, to help them understand what their loved one is going through and how they can be a source of strength and encouragement.
They're an integral part of the support system, and often they're the ones who notice the changes first and encourage their loved one to seek help.
It's about recognizing that addiction affects the entire family system and everyone involved needs support. And finally, I think it's really important to emphasize the long-term nature of substance use disorder treatment and recovery.
It's not a quick fix.
Absolutely not. It's an ongoing process that requires ongoing support, and there will be ups and downs along the way. But it's crucial that we, as nurses, stay committed to helping our patients through those challenges and empowering them to find their path to a healthier and more fulfilling life.
And I think the American Nurses Association Code of Ethics provides us with that guiding framework, reminding us of our professional obligations to provide compassionate and ethical care to all of our patients, regardless of their diagnosis or the substance they may be struggling with.
That's right. It's about upholding those professional standards and recognizing the inherent dignity and worth of every individual.
Now, let's take a look at some of the critical thinking exercises from the textbook chapter. I think these exercises provide a great opportunity to apply our knowledge to realistic scenarios that nurses often encounter in clinical practice.
I agree. They help us to bridge the gap between theory and practice. And I think they'll be particularly beneficial for you as a nursing student as you're learning to think critically and make sound clinical judgments.
The first exercise presents this scenario. A friend reveals to the nurse that she has been using crack cocaine frequently over the past few months and insists that she can stop anytime she wants. What is the nurse's priority action in this situation?
This scenario is a really common one for nurses, and it can be challenging because it involves navigating personal and professional boundaries. It also highlights that element of denial that is often so prevalent in addiction. The friend's assertion that she can stop using crack cocaine at any time is really a way of minimizing the problem and avoiding that uncomfortable reality of her substance use.
And that's something we've talked about. Addiction is a complex disease that affects the brain, and it makes it really difficult to stop using substances without professional help.
Exactly. So the nurse's priority in this situation is to express genuine concern for her friend's well-being while also maintaining those professional boundaries. It's about finding that balance.
Right. We can't provide treatment to friends or family members, but we can offer support and encouragement to seek help.
Exactly. And it's important to avoid judgment or confrontation because that can push the friend away and make her less likely to open up and accept help.
Shaming or blaming someone is never helpful. Instead, we can gently encourage her to consider those potential risks and consequences of continued crack cocaine use, emphasizing that addiction is a treatable condition.
And we can remind her that seeking help is a sign of strength, not weakness.
It's about shifting that perspective and helping her see that there is hope for recovery.
And offering resources and support is crucial. The nurse can provide her friend with contact information for local treatment centers, support groups, or helplines. Just having those resources available can make a big difference.
It's about planting those seeds of hope and letting her know that she's not alone in this journey.
Exactly. Now, the second critical thinking exercise poses a different kind of challenge. It says, a patient is admitted to the hospital for major abdominal surgery, and the physician has ordered that a transdermal nicotine patch be used while the patient is hospitalized because the patient was a heavy smoker. While the patch is applied, the patient asks, why in the world would you want to give me nicotine when I'm trying to stop smoking? What is the nurse's priority when answering the patient's question?
This is a really common question, and I think it gets at those misconceptions about nicotine replacement therapy that are out there. Patients often don't understand why they would receive nicotine when they're trying to quit.
Right. They see it as counterintuitive. But the nurse's priority in this situation is to explain to the patient that the nicotine patch is there to help manage their withdrawal symptoms and reduce their cravings while they're in the hospital and unable to smoke.
And it's important to emphasize that the patch delivers a controlled dose of nicotine, which helps to prevent those intense urges and discomfort that can interfere with post-surgical healing.
Exactly. We want to help the patient be as comfortable as possible so they can focus on their recovery from surgery.
And this is also a great opportunity to acknowledge the patient's desire to quit smoking and commend them for their efforts.
We can reinforce their commitment to quitting and use this as a teachable moment to talk about the benefits of smoking cessation and encourage them to consider quitting for good after they recover from surgery.
Maybe even connect them with resources for smoking cessation programs once they're discharged.
Exactly. We want to support them in any way we can.
Okay, let's shift gears now and take a look at the review questions at the end of this textbook chapter. I always find these review questions helpful in solidifying my understanding of the key concepts.
They're a great way to test your knowledge and make sure you've grasped those essential points.
The first review question asks, a patient is experiencing withdrawal from opioids. The nurse expects to see which assessment findings most commonly associated with acute opioid withdrawal. And the answer are elevated blood pressure, decreased pulse, lethargy, diaphoresis, vomiting, and constipation.
So based on our discussion of opioid withdrawal earlier, we know that the correct answers are elevated blood pressure, diaphoresis, which is sweating, and vomiting. Those are all classic symptoms of opioid withdrawal, and they reflect the body's physiological response to the sudden discontinuation of opioids.
Okay, the second review question asks, during treatment for withdrawal from opioids, the nurse expects which medication to be ordered. The choices are amphetamine, clonidine, diazepam, and disulfiram.
The correct answer here is clonidine. Clonidine is an alpha-2 adrenergic agonist, and it works by reducing that autonomic hyperactivity that we see with opioid withdrawal. So it helps to manage those uncomfortable symptoms like sweating, tremors, and anxiety, making the detoxification process a little bit easier for the patient.
Okay. The third review question asks, the nurse is presenting a seminar on substance use disorders. Which drug is the most commonly used illicit drug in the United States? The choices are crack cocaine, heroin, marijuana, and methamphetamine.
So according to our sources, the most commonly used illicit drug in the United States is marijuana. While the other substances on that list are definitely problematic and widely abused, marijuana still tops the list in terms of overall use.
And the fourth question presents this scenario. A patient who is taking disulfiram as part of an alcohol treatment program accidentally takes a dose of cough syrup containing a small percentage of alcohol. The nurse expects to see which symptom as a result of acetaldehyde syndrome. And the choices are insomnia, copious vomiting, hypertension, and no ill effect because of the small amount of alcohol.
So we know that disulfiram works by inhibiting the enzyme that breaks down acetaldehyde, which is a byproduct of alcohol metabolism. So even a small amount of alcohol can trigger a reaction when someone is taking disulfiram, and that reaction is called acetaldehyde syndrome. The correct answer here is copious vomiting.
So it's not a pleasant experience. And it's really important to educate patients about the potential for this reaction so they can avoid alcohol in any form.
Absolutely. Even small amounts of alcohol in things like mouthwash or cough syrup can trigger this reaction, so it's really about complete abstinence.
The fifth review question asks, the nurse is assessing a patient for possible substance use disorders. Which assessment finding indicates possible use of amphetamines? The choices are lethargy and fatigue, cardiovascular depression, talkativeness and euphoria, and difficulty swallowing and constipation.
The correct answer here is talkativeness and euphoria. Amphetamines are stimulants, so they increase alertness, energy, and mood. And that talkativeness and euphoria are characteristic signs of amphetamine intoxication.
Okay, so we're looking for those behavioral and psychological changes.
Exactly. And those can be really telling signs of stimulant use.
The sixth review question poses another scenario. A patient experiencing ethanol withdrawal is beginning to show severe manifestations of delirium tremens. The nurse will plan to implement which interventions for this patient? And the choices include doses of an oral benzodiazepine, doses of an intravenous benzodiazepine, restraints if the patient becomes confused, agitated, or a threat to himself or others, thiamine supplementation, oral disulfiram treatment, and monitoring in the intensive care unit.
So delirium tremens, or DTs as it's sometimes called, is a severe and potentially life-threatening complication of alcohol withdrawal. It's characterized by confusion, agitation, hallucinations, and autonomic instability. So the correct interventions for a patient experiencing DTs include intravenous benzodiazepines to control those withdrawal symptoms, restraints if necessary to ensure the patient's safety and the safety of others, thiamine supplementation to prevent Wernicke's encephalopathy, a serious neurological condition that can occur with alcohol withdrawal, and monitoring in the intensive care unit for close observation and supportive care.
It's about providing that intensive level of care that these patients need to get through this very dangerous phase of withdrawal.
Right. Because DTs can be fatal if not managed properly.
The seventh question asks, a patient has been admitted to the emergency department after a suspected overdose of benzodiazepines mixed with alcohol. The patient is lethargic and cannot speak. The nurse expects which immediate measures to be implemented. And the choices include preparing to administer naloxone, preparing to administer flumazenil, monitoring the patient for hyperthermia, preparing for potential respiratory arrest, and applying restraints.
So we know that benzodiazepines and alcohol are both central nervous system depressants. So when taken together, they can have a synergistic effect, leading to more profound sedation and respiratory depression. In a suspected overdose of this combination, the immediate priorities are to ensure airway patency and support breathing. So the correct answers here are preparing to administer flumazenil, which is a benzodiazepine antagonist that can reverse the sedative effects of benzodiazepines, and preparing for potential respiratory arrest. That may involve having intubation equipment readily available, oxygen, and being prepared to assist with ventilation if necessary.
So we're really focusing on those life-saving interventions in this scenario.
Exactly, because the combination of benzodiazepines and alcohol can be lethal, and we need to be prepared to act quickly to stabilize the patient.
And the final review question asks, the nurse is teaching a class about the effects of alcohol. Long-term excessive use of alcohol is associated with which of these problems? And the choices include coronary artery disease, Wernicke's encephalopathy, polyneuritis, seizures, cirrhosis of the liver, and Korsakoff psychosis.
So the correct answers here are Wernicke's encephalopathy, polyneuritis, cirrhosis of the liver, and Korsakoff's psychosis. These conditions all highlight the devastating and wide-ranging consequences of chronic alcohol abuse.
Wernicke's encephalopathy, as we mentioned earlier, is a neurological disorder caused by thiamine deficiency, often seen in people with chronic alcohol use. It can lead to confusion, memory problems, and problems with coordination.
And polyneuritis is nerve damage, also commonly associated with chronic alcohol use. It can cause pain, numbness, tingling, and weakness in the extremities.
Cirrhosis of the liver is a severe and often fatal liver disease that can develop from long-term alcohol abuse. It's characterized by scarring and damage to the liver, which can impair its function.
And Korsakoff psychosis is a chronic memory disorder that can result from Wernicke's encephalopathy. It's characterized by severe memory impairment, confusion, and difficulty with learning new information.
It's really a stark reminder of how alcohol can really damage the brain and body.
And it underscores the importance of early intervention and treatment for alcohol use disorders to prevent these devastating long-term consequences.
It's not just about the acute effects of intoxication. It's about those long-term health implications that can really impact someone's quality of life.
Absolutely. And it highlights the importance of our role as nurses in providing education, counseling, and support to our patients who are struggling with alcohol use disorders. We need to help them understand the risks and empower them to make healthier choices for themselves.
I think those review questions were incredibly helpful in reinforcing those key concepts about substance use disorders, their assessment and management. They really challenged us to think critically and apply that knowledge to real-world clinical scenarios.
I agree. And I think they provide a valuable foundation for nurses and nursing students who are caring for patients with these complex conditions.
Now let's transition to those critical thinking exercises, which, as we've mentioned, are designed to challenge us even further and encourage us to think deeply about the nursing care of patients with substance use disorders.
These exercises are fantastic because they provide those realistic scenarios that we might encounter in clinical practice, forcing us to really think through those complex situations and make those evidence-based decisions.
The first exercise presents this scenario. A friend has revealed to the nurse that she has used crack cocaine often in the past few months and states that even though she enjoys the sensations, she can stop at any time. What is the nurse's priority action in this situation?
This scenario is a perfect example of those common challenges we face as nurses when confronted with substance use disorder in our personal lives. It can be difficult to separate those personal and professional boundaries, but it's really important to maintain that professional distance. We can't be our friend's
All
therapist.
right. And we also have to remember that denial is a powerful force in addiction. That insistence that she can stop at any time is a classic sign of denial, and it's a way for her to avoid facing the reality of her substance use.
Exactly. So the nurse's priority in this situation is to express genuine concern for her friend's well-being while also maintaining those professional boundaries.
And it's really important to avoid judgment or confrontation, because that can just push her away and make her less likely to seek help.
Instead, we can gently encourage her to consider the potential risks and consequences of continued crack cocaine use, emphasizing that addiction is a treatable condition. We can plant those seeds of hope, but ultimately the decision to seek treatment has to come from her.
And we can offer support by providing her with information about local treatment centers, support groups, or helplines.
Exactly. Just letting her know that those resources are available and that she's not alone in this can make a big difference.
Now let's look at the second critical thinking exercise, which poses a different kind of challenge. It says a patient is admitted to the hospital for major abdominal surgery, and the physician has ordered that a transdermal nicotine patch be used while the patient is hospitalized because the patient was a heavy smoker. While the patch is applied, the patient asks, "Why in the world would you want to give me nicotine when I'm trying to stop smoking?" What is the nurse's priority when answering the patient's question?
This scenario highlights the importance of patient education and really addressing those common misconceptions about nicotine replacement therapy.
Because it seems counterintuitive to a lot of people. They think, why would I want to take nicotine when I'm trying to quit?
Exactly. And the nurse's priority is to explain to the patient that the nicotine patch is intended to help manage their withdrawal symptoms and reduce those cravings while they're in the hospital and they're unable to smoke.
It's about helping them through that difficult period of acute withdrawal so that they can focus on their recovery from surgery.
Exactly. And it's also a great opportunity to acknowledge the patient's desire to quit smoking and to commend them for their efforts.
Absolutely. We want to reinforce that positive intention and maybe even talk about the benefits of smoking cessation and encourage them to consider quitting for good once they've recovered from surgery.
It's about planting those seeds and providing that ongoing support and encouragement.
I think these critical thinking exercises really highlight the multifaceted nature of our role as nurses in caring for patients with substance use disorders. It's not just about administering medications and monitoring vital signs. It's about providing compassionate care, education, and advocacy to help our patients navigate the complexities of addiction and find their path to recovery.
Absolutely. And these exercises are a great way to develop those critical thinking skills that are essential for effective nursing practice.
As we wrap up this deep dive into substance use disorder, I want to leave our listeners with a few key takeaways. First and foremost, remember that addiction is a disease, not a choice. It's a complex medical condition that affects the brain, and it's often accompanied by a lot of shame and stigma.
Right. And it's so important to approach our patients with empathy, understanding, and a willingness to help.
We need to meet them where they are and offer them the support they need without judgment.
Exactly. And it's also crucial to remember that substance use disorders often coexist with other mental health conditions like depression, anxiety, trauma. So we need to be assessing for and addressing those co-occurring conditions as part of a comprehensive treatment plan.
And recovery is a journey, not a destination. It's not linear. There will be setbacks and challenges along the way, and that's okay. It's important to support our patients through those challenges and to celebrate their successes, no matter how small they may seem.
We need to be their cheerleaders, their advocates, their source of strength and encouragement.
And finally, I want to remind our listeners of the profound impact they can have on their patients' lives. As nurses, you are in a unique position to make a real difference in the lives of people who are struggling with substance use disorders.
By providing compassionate care, education, and advocacy, you can help your patients find their path to recovery and reclaim their lives.
And never underestimate the power of simply listening without judgment and offering a kind word or a helping hand. Those small gestures can make a world of difference.
And remember, your role as a nurse extends beyond the bedside. You can be an advocate for policy changes, for increased funding, for treatment and prevention programs, for reducing stigma and promoting understanding of addiction as a disease.
So keep learning, keep advocating, keep being that voice of compassion and support.
And never stop believing in the power of recovery.
It's been an incredible journey exploring the world of substance use disorder. I hope our listeners are leaving this deep dive feeling more knowledgeable and empowered to provide exceptional care to their patients. Until next time, keep diving deep. Now let's move on to those critical thinking exercises from the textbook chapter. I think they're a great way to apply our knowledge to some of those real-world scenarios that we might encounter as nurses.
Yeah, absolutely. They help to bridge that gap between theory and practice and really force us to think critically about how we would approach these complex situations.
The first exercise presents this scenario. A friend reveals to the nurse that she has been using crack cocaine frequently over the past few months and insists that she can stop anytime she wants. What is the nurse's priority action in this situation?
This is such a classic scenario, and I think it highlights the challenges that we often face as nurses when we're confronted with substance use disorder in our personal lives.
Right, because it's not always a patient. It could be a friend, a family member, a colleague.
Exactly. And it can be really tricky to navigate those personal and professional boundaries.
And we have to remember that denial is a very powerful defense mechanism in addiction.
Absolutely. That insistence that she can stop anytime she wants is a classic sign of denial. It's a way to minimize the problem and avoid facing that really uncomfortable reality.
And as we've discussed, addiction is a complex disease that affects the brain, and it makes it incredibly difficult to just stop using a substance without professional help.
So the nurse's priority in this situation is to express genuine concern for her friend's well-being while also maintaining those professional boundaries.
Right? We can't be our friend's therapist.
Exactly. We can't provide treatment, but we can offer support and encouragement to seek help.
And it's crucial to avoid judgment or confrontation.
Because that can be so counterproductive. It can push her away and make her less receptive to help.
Shaming or blaming never helps. Instead, we can gently encourage her to consider those potential risks and consequences of continued crack cocaine use and emphasize that addiction is a treatable condition.
Right. We want to offer hope, but ultimately the decision to seek treatment has to come from her.
And we can offer support by providing information about local treatment centers, support groups, helplines, things like that.
Just letting her know that those resources are available can be incredibly helpful.
Okay, let's move on to the second critical thinking exercise. It says, a patient is admitted to the hospital for major abdominal surgery, and the physician has ordered that a transdermal nicotine patch be used while the patient is hospitalized because the patient was a heavy smoker. While the patch is applied, the patient asks, why in the world would you want to give me nicotine when I'm trying to stop smoking? What is the nurse's priority when answering the patient's question?
This is such a common question, and I think it highlights the importance of patient education, especially around nicotine replacement therapy.
Because it seems so counterintuitive to a lot of people. Why would I take nicotine when I'm trying to quit?
Exactly. The nurse's priority here is to explain to the patient that the nicotine patch is intended to help manage their withdrawal symptoms and reduce those cravings while they're in the hospital and they're unable to smoke.
And it's important to emphasize that the patch delivers a controlled dose of nicotine.
Right, so it's not the same as smoking a cigarette. It's about helping them get through that acute withdrawal phase more comfortably so they can focus on healing.
And I think this is a great opportunity to acknowledge the patient's desire to quit smoking.
Absolutely. We want to commend them for their efforts and reinforce that positive intention.
And maybe even have a conversation about the benefits of smoking cessation. And encourage them to consider quitting for good once they've recovered from surgery.
It's about planting those seeds and offering ongoing support.
Well, I think we've covered a lot of really important ground in this deep dive into substance use disorder.
We've explored the different categories of substances, how they affect the brain and body, the nursing assessment and care of patients, and even tackled some thought-provoking scenarios.
And I hope our listeners are leaving this deep dive feeling more knowledgeable and empowered to provide truly exceptional care to their patients.
Absolutely, because knowledge is power, and when it comes to substance use disorder, compassion and understanding are essential.
So keep learning, keep advocating, and most importantly, keep caring for your patients with empathy and a belief in their potential for recovery.
Because recovery is possible, and everyone deserves a chance to live a healthy and fulfilling life.
Thanks for joining us, and until next time, keep diving deep.